Welcome to the deep dive where we sift through the sources to bring you clarity and hopefully those aha moments. So imagine this for a second. Your amazing dog, that whirlwind of energy, the one who used to just rocket to the door when you got home. And they start, slowing down, maybe taking a little longer to get up after a nap, or they hesitate before jumping onto the couch for cuddles, or maybe that morning walk isn't quite the enthusiastic sprint it once was. It's so easy to think, they're just getting older, right? It's just part of life. But what if it's not just age? What if it's this silent, often misunderstood condition that we, as their people, actually have the power to profoundly impact? Today, we're embarking on a deep dive into canine arthritis. You might also hear it called osteoarthritis or degenerative joint disease. This isn't just, a side effect of growing old. It's a chronic pain condition and can really diminish their quality of life. So our mission today is to equip you, our listener, our co-explorer, with the crucial knowledge to really understand, identify, and importantly, proactively manage this incredibly common condition. We've pulled together a whole stack of comprehensive sources, and we're dissecting everything from the underlying science to the subtle symptoms, the whole diagnostic journey, and a truly multifaceted management approach. Okay, let's dig in. Let's uncover how we can help our beloved dogs live their most comfortable lives.
Yeah, it's such an essential conversation. And like you said, understanding what's actually happening inside that joint. Well, that's the first critical step toward doing something effective about it. At its core, canine arthritis is it's a chronic pain condition. Yeah. It's driven by inflammation and this gradual, relentless degeneration of a dog's joints. What's truly fascinating and kind of heartbreaking, really, is how something that seems so simple, like just cartilage wear, can spiral into this really complex systemic issue. It affects their whole body,
Right, not just the one sore spot.
Exactly. Let's try to visualize it for a moment. Picture a healthy joint. It's a marvel of natural engineering, honestly. You have the ends of two bones, smooth, perfectly lined up, and they're capped with this incredible elastic cartilage. It's like a cushion. And it's all bathed in this thin layer of lubricating synovial fluid. That whole setup allows for almost frictionless, comfortable movement, like a perfectly oiled hinge,
Makes sense. Smooth sailing.
Smooth sailing. And now contrast that with an arthritic joint. That beautiful elastic cartilage, it's damaged, it's worn down, thinning out. It's like the shock absorber on your car is just slowly disintegrating.
Ouch.
Yeah. And this leads to bone rubbing against bone, which is inherently painful. And to make matters worse, that vital lubricating synovial fluid also diminishes, which just increases the grinding. Now, this process doesn't just stop there. It creates this vicious cycle. Persistent inflammation and pain cause even more damage to the joint structures around it. It's progressive, and fundamentally, it's an incurable disease. It will worsen over time. However, and this is the critical paradox understanding, this isn't like a death sentence. It's the ultimate call to action. Our sources show that with early active intervention, we can fundamentally shift the trajectory. We can turn what could be a rapid decline into years of comfortable quality life.
So it's less about fixing it and more about managing the situation. Re-engineering your comfort, maybe?
Precisely. Re-engineering their comfort. That's a great way to put it. And it's also important to realize, like I mentioned, arthritis affects the entire joint organ, the capsule, the ligaments, everything, and even the musculoskeletal system beyond just that immediate joint.
That stark image, the healthy versus the arthritic joint, it really brings home the silent struggle, doesn't it? But before we even get into symptoms, let's tackle that common assumption. It's not just an old dog's problem, is it? Who's really at risk here? What did the sources surprise you with on that?
Well, you're right. That's a huge misconception.
Yeah, what really stood out in our research was that, yes, we often link arthritis to old age, typically dogs maybe 7 to 12 years old or even 8+. But the picture is way more complex than that. Younger dogs, surprisingly, can absolutely develop arthritis. And this is often because of specific things like a joint injury they had, or maybe what we call congenital diseases, things they're born with, like hip dysplasia or elbow dysplasia, or even certain immune-mediated diseases can trigger it.
Right, those underlying conditions.
Exactly. And breed plays a huge role too. Larger breeds, think German Shepherds, Labradors, Golden Retrievers, they're unfortunately more susceptible. Why? Well, it's kind of simple physics, really. Their larger size just naturally puts more stress on their joints over their lifetime.
Makes sense. More wear and tear.
More wear and tear. And here's where it gets really interesting and frankly, a bit alarming. Obesity. It's a monumental risk factor. And it's not just the mechanical stress, the extra weight pressing down. What's truly startling, what the research shows, is that fat cells themselves, they're like tiny inflammation factories.
Inflammation factories?
Yeah, they actively pump out chemicals, mediators that worsen arthritis throughout the body. It's systemic. So losing even a few pounds doesn't just lighten the load on the joints, it actually helps shut down that internal inflammatory attack. It's huge.
That's a really powerful insight. It gives owners more leverage than just thinking about weight as like physical pressure.
Totally. And then there are other contributing factors too, of course. Genetics play a part. Overexercise, especially in early life when things are still developing. A poor diet lacking the right nutrients. Even environmental stuff like living in cold regions or young puppies going up and down stairs too early. That puts premature strain on those developing joints. And while, arthritis can hit any joint, our sources point mostly to the hips, the knees, which vets call the stifle elbows, and wrists, also the legs generally, hips, and the back.
That point about the fat cells as inflammation factories is so crucial. It immediately gives owners something tangible beyond just, mechanical stress. But the real challenge often for you, the owner, lies in spotting the symptoms because, as you hinted, host, they develop so gradually, they're so easily mistaken for just getting older.
Yeah.
And this raises a really important question, doesn't it? Are we truly recognizing the subtle signs of pain, or are we kind of dismissing them as just an inevitable part of aging?
That's the million-dollar question, right? How do we know?
Well, you might first notice changes in their mobility and activity. This could start as really subtle limping or just changes in their gait, maybe a slight instability, or they favor one limb a bit. Initially, it might seem worse in the morning or after they've been resting for a while, and then it gets a bit better as they warm up. But as the disease progresses, that limping tends to become more constant. And here's a really crucial point. If multiple joints are affected, sometimes the limping isn't even obvious. They might just look generally stiff all over.
So not always a clear limp if both sides hurt, maybe.
Exactly. That stiffness, especially after rest, like first thing in the morning, after naps, or even in cold weather, that's a classic sign. You might also see a reduced activity level, a clear unwillingness to exercise. They lose interest in their favorite things. Walks, playing fetch, running, jumping. That heartbreaking moment when they don't rush to the door to greet you anymore, that's a potential red flag.
Yeah, that one hits home for a lot of people, I bet.
It does. Difficulty rising is another key indicator. They'll be slow, stiff, maybe seem painful when getting up from lying down or sitting. And this is often worse on slippery floors like tile or hardwood. You might also see a reluctance to jump onto furniture or climb stairs. Maybe they suddenly need help getting into the car when they never did before. Other subtle mobility shifts could be slower, walking in general, leg weakness, or even collapsing sometimes. Or maybe they adopt a narrower stance in their hind limbs, trying to shift weight off the sore spots.
And I guess for many of us, when that explosion of joy at the door becomes more of a quiet, cautious waddle, it's a real gut punch, isn't it? It's those little moments that just scream, something's changed.
Absolutely. Those little moments add up. And beyond those mobility clues, there are more direct signs of pain and physical responses. They might show obvious pain or discomfort like a yelp or a whine or a groan maybe when you touch them or when their affected joints are moved in a certain way. Frequent licking or chewing of the painful joint areas is also really common. It's like a self-soothing behavior.
Trying to make it feel better themselves.
Exactly. Sometimes you might even notice visible swelling or feel warmth around the affected joints. And importantly, chronic pain can lead to really profound behavioral and body changes. Their whole personality might shift. They could become more irritable, maybe more reclusive or anxious. They might even snap or show aggression if they anticipate being touched in a sensitive area. It's not them being bad, it's pain talking.
That's such an important point. The personality change isn't malicious.
Not at all. You'll likely see increased rest, too, spending more time sleeping or just lying down, because being still often offers some temporary pain relief. And circling back to our earlier point about weight gain often becomes this vicious cycle here. Reduced activity leads to more weight, which then puts more pressure on the joints, making the pain worse, leading to less activity. You see.
Downward spiral.
Precisely. And finally, keep an eye out for muscle atrophy. That's a wasting away of muscles around the affected joints. It's particularly noticeable sometimes in the hind limbs because they stop using those painful limbs as much.
Wow, okay. Those symptoms you've listed are so critical, expert. And honestly, some of them are incredibly subtle. It really makes me wonder, if an owner is seeing these kinds of nuanced changes, what's their very first, most crucial step? I mean, we can't just guess, right? How does a vet actually confirm it's arthritis.
No, you absolutely can't guess. Self-diagnosis is definitely risky.
Right. So getting that professional diagnosis is just paramount. Canine arthritis needs a thorough veterinary evaluation, a really comprehensive assessment to figure out what's truly going on. Your vet plays the central role here. They'll do a meticulous physical exam, carefully palpating all of your dog's joints, checking for any signs of pain, swelling, or heat. They'll also watch how your dog stands and moves their posture and gait, looking for any limping or reluctance to put weight on a limb. And this is where your detailed observations become incredibly important.
Absolutely. The owner's history is key.
Yeah, be ready to share everything you've noticed. All those subtle changes in behavior, activity levels, stiffness. It gives the vet invaluable context. Then there are imaging tools.
Yeah.
X-rays are probably the most common. They can show really telling bone changes, like osteophytes. Those are bone spurs.
Little bony growths, yeah.
Right? Or hardening of the bone under the cartilage, maybe some joint fluid buildup and a narrowing of the space within the joint. That shows the cartilage is thinning. For more complex cases, or if they need a really detailed look, your vet might suggest advanced imaging, like an ultrasound or maybe even an MRI scan.
To get a much clearer picture of the soft tissues too.
Exactly. They might also run blood tests, check overall health, rule out other conditions, maybe your urinalysis. And there are also specific pain assessment tools vets use now, like the Glasgow Composite Measure of Pain Scale. And quality of life questionnaires, things called LOW-A or CSI. These are like specific diagnostic frameworks that help the vet understand the day-to-day impact on your dog's activities. How much is this really affecting them? Some vets even use something called the Canine Osteoarthritis Staging Tool, or COAST. It's a standardized way to classify the condition, usually from 0 to 4, based on various factors. It gives a clear sort of roadmap for treatment. It's this comprehensive approach that ensures they get the diagnosis right.
Absolutely. And once that diagnosis is confirmed, the focus really shifts, doesn't it? From identification to proactive management. As we've said, it's incurable, but, and this is the crucial part that absolutely does not mean we can't significantly improve their quality of life, the core principle here is this multi-systemic, individualized approach. And it's always developed in partnership with your veterinarian. If we connect this back to the bigger picture, you can see how managing arthritis isn't just about, say, giving a painkiller. It's about addressing multiple aspects of joint health, often all at the same time, to create a truly holistic plan.
Holistic, right, not just one magic bullet.
Right. Exactly. So first, let's talk about professional treatment. This is obviously vet-led. Veterinary prescription medications are usually paramount. Non-steroidal anti-inflammatory drugs, NSAIDs, they're usually the first choice. You might recognize names like carprofen or meloxicam. These are specially formulated for dogs to reduce both pain and inflammation. And here's a critical warning. I mean, this cannot be stressed enough. Never, ever give human NSAIDs like ibuprofen or acetaminophen to your dog. They are toxic. They can be fatal.
Okay, that's super important. Human meds are a no-go.
Absolutely non-negotiable. And if your dog is on canine NSAIDs long-term, regular monitoring of their liver and kidney function is essential just to ensure their safety. Now, corticosteroids, they're powerful, they act fast, but they come with pretty high long-term risks. Things like increased thirst, weight gain, muscle weakness, even immune suppression. So they're typically reserved for really acute flare-ups, or maybe if a dog just can't tolerate NSAIDs. And importantly, they must never be used at the same time as NSAIDs.
Okay, good to know. What else is in the vet's toolkit?
Well, there's gabapentin. That's often used for chronic pain, especially if there's a nerve pain component, neuropathic pain. It's frequently used in combination with other pain relievers. There's also amantadine. This helps prevent something called wind-up pain. It sounds a bit dramatic.
Like something from a superhero movie.
Kind of, but it's a real thing where the nervous system basically becomes hypersensitive to pain signals. Amantadine helps block that, and it can make other painkillers work better. It's often used as a supplement in the pain management plan. Then we have a category called disease-modifying osteoarthritis drugs, or DMOs. Adequan is one. It involves injections of PSG.
PSGs.
Yeah, polysulfated glycosaminoglycans. Basically, compounds that help replenish the building blocks of cartilage. They work to reduce inflammation and protect the existing cartilage. And a newer, really exciting option is Librela. The drug name is bedenvetmab. It's a monthly injection, and it's shown significant effectiveness for moderate to severe OA. It works by targeting something called nerve growth factor, which is a key mediator of pain signals.
Wow, so some really targeted therapies coming out.
Definitely. And beyond medication, adjunctive therapies are incredibly valuable. Think professional physical therapy and rehabilitation. This can include specific therapeutic exercises, maybe sessions on an underwater treadmill, which is fantastic for joints and massage. All of this helps improve muscle strength, joint mobility, and reduce pain. It's like specialized personal training for their joints.
I love that idea. Personal training for dogs.
Pretty much. Acupuncture, performed by a qualified vet, can also significantly improve mobility and reduce pain for many dogs. We see good results with that. Laser therapy, technically called photobiomodulation, just means using specific wavelengths of light. It helps stimulate cell regeneration, increase blood circulation, and reduce inflammation. It's another non-invasive option. For more severe cases, there are interventional joint treatments, things like biologics, maybe stem cell therapy or PRP, which is platelet-rich plasma injections, or even corticosteroid injections directly into the joint for localized relief. And really, as a last resort, if conservative treatments just aren't cutting it, or in cases of really severe joint damage, surgery might be on the table. Options include joint replacement, like a total hip replacement, joint fusion, or even excision arthroplasty, where they remove the damaged joint surfaces.
Okay, expert, that was an incredibly thorough look at the veterinary arsenal. I mean, that's a lot of options. But I imagine many listeners are sitting there thinking, okay, what does this mean for me, in my living room every single day? Because while the clinic visits are vital, our sources really hammered home just how much power owners have at home, didn't they? What are those key strategies for home care?
You're absolutely right. The home environment and daily management are hugely impactful.
Yeah, you have so much power to make a difference in your dog's daily comfort. So let's dive into that. Home care and management. Okay, so when it comes to home care, if you had to pick just one thing, the single most impactful thing an owner can do, what would it be? Our sources kept coming back to weight management. Why is that so profoundly critical?
It truly is the most important measure you can take at home. Number one, maintaining an ideal body weight significantly reduces the pressure on those joints. That's just simple physics, right? Less load. But remember what we talked about earlier, those fat cells being mini inflammation factories.
Right, the double whammy.
Exactly. So by reducing excess weight, you're not just lightening the mechanical load on the joints, you're also actively reducing the systemic inflammation that fuels the arthritis process. Our sources consistently highlight that even a modest weight loss, like just 6% of body weight, can dramatically improve a dog's comfort and mobility. It's huge.
That makes perfect sense. So it's a double win. Less strain, less internal inflammation. Okay, so weight is king. What about diet beyond just the quantity?
Well, absolutely. Diet and nutrition overall are key. High-quality, age-appropriate food is the foundation, and your vet might even recommend joint-specific prescription diets. These are specially formulated, often containing natural anti-inflammatory components, maybe antioxidants or specific omega-3 fatty acids, all designed to support joint health from the inside out.
Okay, prescription diets. What about things people can buy over the counter, like supplements? We hear a lot about those.
Yeah, there are several common ones. Over-the-counter supplements like glucosamine and chondroitin are probably the most well-known. They're natural components of cartilage, and the thinking is they may help with repair and reducing inflammation. Just know they typically take about 4 to 6 weeks to show any effect, so you need patience. And they can usually be safely combined with prescription medications. Omega-3 fatty acids, specifically the ones called EPA and DHA, usually from fish oil, definitely have natural anti-inflammatory properties. Again, patience is key. It often takes 4 to 12 weeks to see the full effect. And always use dog-specific products. Human supplements might have different ratios or additives.
Good tip. Dog-specific. What about CBD? That comes up a lot, too.
It does. CBD products. Well, it's an area of ongoing research for pain and inflammation in dogs. There's anecdotal evidence, but the science is still catching up. If you're considering CBD, you absolutely must consult your vet first. The American Kennel Club actually points out there's still a lack of sufficient scientific data right now to fully back its use for canine arthritis. So professional guidance is non-negotiable there. Don't just grab something off the shelf.
Got it. Vet consultation first. Now, let's shift gears slightly. Making their environment work for them, not against them. Tell us about environmental modifications.
Yes, this is huge for daily comfort. Simple changes can make a big difference. Provide a warm, draft-free, and really supportive orthopedic bed. Something firm and supportive is much better for arthritic joints than a soft, squishy bed they sink into. Lay down non-slip rugs or mats on slippery floors, tile, hardwood, laminate. This helps prevent falls and helps them move more confidently, especially when getting up or changing direction. Less slipping means less jarring on sore joints. Use ramps or small pet stairs to help them get onto furniture, onto your bed, or into the car. Every jump they don't have to make reduces strain and impact on those precious joints.
That seem like really practical, achievable things. What about exercise? We know they need to move, but how do we manage that?
That's the balancing act, isn't it? Exercise management is crucial. The goal is controlled activity. Encourage short, low-intensity, but regular exercise. This helps maintain joint mobility and muscle strength around the joints. But, and this is a big, but you absolutely need to avoid high-impact activities. Things like jumping for frisbees, fast running, sudden stops and starts, those are generally out. Swimming, however, is an excellent option. Why? Because the buoyancy of the water dramatically reduces the pressure on their joints, but they still get a fantastic muscle workout.
Hydrotherapy at home, almost.
In a way, yes. And your vet or a rehab professional can guide you on specific home rehabilitation exercises. Things like gentle range of motion exercises, maybe setting up some poles to weave through slowly, pole weave, sidestepping, or controlled sit-to-stand repetitions. These can be tailored to your dog's specific needs and abilities. Finally, think about supportive comfort therapies. Simple things like hot or cold packs can help. Warm packs might ease morning stiffness, while cold packs can reduce discomfort after activity. Always wrap them in a towel, never apply directly to the skin, and limit it to 10-15 minutes. Gentle massage of the muscle groups around the sore joints can also help relieve tension and pain. Plus, it's great for bonding and just providing comfort.
That's wonderful. It feels like there's so much we can do.
There really is. And this partnership between the professional veterinary care and your dedicated home management, it's continuous. It's not a one-time fix, right? It's an ongoing process. Your close collaboration with your veterinarian is absolutely crucial. For the initial diagnosis, yes, but also for adjusting treatment plans as needed over time and for monitoring for any potential side effects from medications. And again, it really bears repeating. Never self-medicate your dog with human painkillers and never adjust medication doses without talking to your vet first.
That constant communication is key.
It really is. And as an owner, your vigilance is just as important. Closely monitor your dog's activity levels, watch their gait, notice any changes in stiffness, check their mood, look for any subtle signs that the pain might be worsening or that the current plan needs tweaking. Regular follow-up vet visits are essential. They allow the vet to assess how effective the treatment plan is and make any necessary changes to ensure your dog stays as comfortable as possible. This is an evolving plan, always responsive to your dog's changing needs over time.
Wow. What an incredible deep dive today. We've really journeyed from understanding the complex science behind canine arthritis, those worn down cartilage cushions, even those surprising inflammation-producing fat cells, all the way to outlining this truly comprehensive, multifaceted strategy for managing it. We've seen how crucial early detection is, how varied and sometimes subtle those symptoms can be, and how this real team effort between you, the listener, and your vet can dramatically improve your dog's quality of life. By applying this knowledge, by truly seeing those subtle shifts and taking these proactive steps, you are empowering yourself. You're helping your arthritic dog live a more comfortable, more dignified, and ultimately a more joyful life. And while canine arthritis is definitely a journey, isn't it? Not really a destination. Perhaps the most profound impact we can have is not just in managing their pain, crucial as that is, but maybe it's in recognizing that their slowdown isn't necessarily a farewell to joy. Maybe it's more like a call for us to adapt, to deepen our care, and to really transform their golden years into a period of continued comfort and connection.
Thank you so much for joining us on this deep dive. We really hope this knowledge empowers you and your beloved companion.